Chapter 30, Ophthalmology and Otolaryngology. Medical assistants working in general family practice and pediatric offices also encounter patients with eye or ear disorders and are expected to perform basic procedures associated with the eyes, the ears, the nose, and throat in these settings as well. So, medical assistants working for ophthalmologists or otolaryngologists, also known as ENT physicians, are expected to perform basic procedures associated with these body systems. So, an ophthalmologist is a physician who specializes in the treatment of disorders of the eyes, and then your otolaryngologists are physicians who specializes in the treatment of diseases and disorders of the ears, nose, and the throat. So, common disorders of the eye. It is a complex, highly developed organ. It is where we see. It helps with seeing. The light waves are reflected off objects that are transmitted to the eye structures, which include the cornea, the lens, and the retina. And then the impulses are transmitted via the optic nerve to the occipital lobe of the cerebral cortex in the brain. So when the rays of light are bent or refracted by the curvature of the cornea and lens, the occiput recognizes whether the objects are in or out of focus. This is a picture of the eye, and this photo is also on page 763 in your books. This is a box which talks about assisting your sight impaired patients. It just gives you some steps on helping your sight impaired patients, and it will be good for you to read page 763 in your book. So, cataract is a common eye disorder. It is usually gradual, progressive in the elderly. It can be congenital or due to certain types of trauma. You treat this by surgical removal of the cloudy lens and replacement. An ophthalmoscope is used in this procedure or to diagnose. It is a lighted instrument used to examine the inner surfaces of the eye. A cataract is an opacity or cloudy of the lens that leads to decreased visual acuity. A stye or a hordeolum. It is an infection of the lacrimal gland with Staphylococcus aureus. You treat it with warm compresses, and then you can use a topical antibiotic drops or ointment. Your hordeolum is an infection of any of the lacrimal glands of the eyelids, causing redness, swelling, and pain. So a stye is, or a hordeolum is an infection of any of the lacrimal glands of the eyelids, causing redness, swelling, or pain. Conjunctivitis. Comes from bacteria. It can come from viruses or allergies. You treat it with antibiotic ointments and good hygiene. So conjunctivitis is an infection of the mucous membrane covering the sclera and the cornea of the eye, and it is caused by several species of bacteria or viruses. And conjunctivitis is also known as pink eye. So, precautions to avoid conjunctivitis. You want to try to avoid rubbing your eyes. Discard all eye makeup that may be infectious, and then wash all your towels, washcloths, and pillowcases after each use. Your bacterial and viral conjunctivitis or pink eye, it is highly contagious and can rapidly spread through schools and daycare centers. A corneal ulcer. A corneal ulcer is an erosion of the surface of the cornea, leaving scar tissue that may lead to visual disturbances or blindness. It is caused by pathogens or trauma. The signs and symptoms would be tearing, some pain on blinking, sensitivity to light. You treat it with rest and then with some antibiotics. Retinopathy. Retinopathy is a general term for a disease or a disorder affecting the retina. There is a decrease of blood supply, which can lead to retinal degeneration. A retinal degeneration is the pathologic changes in the cell structure of the retina that impair or destroy its function, that could result in blindness. So the causes include atherosclerosis that impedes the blood flow to the retina, the microcirculatory changes associated with diabetes, which is your diabetic retinopathy, and vascular changes resulting from long-term hypertension. So retinopathy, you have atherosclerosis. Person could be diabetic. They could possibly have hypertension. It leads to blindness. So what you want to do is you want to treat the underlying cause. Your fluorescein angiography helps to diagnose your retinopathy, and it is an intravenous injection of fluorescent dye. It photographing the blood vessels of the eye as the dye moves through them. Glaucoma. Glaucoma describes a group of disorders that result in increased intraocular pressure. So increased pressure within the eye that is due to decreased outflow of the aqueous humor. Your intraocular pressure is just your pressure within the eyeball. Any pathology that impedes the outflow of the aqueous humor, whether it be genetic or from vasoconstriction, will increase the pressure either very gradually or quite suddenly. The gradual form of glaucoma, which is your open angle glaucoma. It may present with mild or no pain. They may get some visualizing of halos around lights and loss of their peripheral vision. Whereas your angle closure glaucoma is acute and sudden blockage, and it's characterized by severe eye pain, blurred vision, headache, nausea, and vomiting. Blindness may result within days of the onset of gradual glaucoma unless the condition is diagnosed and treated quickly. And so treatment for chronic glaucoma, it includes medication, often a diuretic, to decrease the intraocular pressure by slowing the formation of the aqueous humor within the eyes or by improving the flow. So acute glaucoma may necessitate an iridectomy or a removal of part of the iris to increase the outflow of the humor. And so frequent eye examinations include tonometry, which is a measurement of the intraocular pressure using a tonometer. So refractive errors. Errors of refraction are the most common of all eye problems. Refraction is the bending of light rays that enter the pupil to reflect exactly on the fovea centralis, the area of greatest visual acuity. So the primary types of refractive errors are hypopnea, also known as farsightedness, and it occurs in an eyeball that is too short from front to back to allow the lines of vision to reflect distinctly on the fovea centralis. And then you have myopia, which is also known as nearsightedness, and this results when the eyeball is too long. Astigmatism is an unfocused refraction of light rays on the retina resulting from lens or corneal irregularities. And then presbyopia, which is a vision change resulting from the loss of the lens elasticity with age. So you want to treat with corrective lenses or laser surgery. And this is done by an optometrist, which is a specialist who can measure for errors or refraction and prescribe lenses, but who cannot treat the diseases of the eye or perform those type of surgeries. So here it just shows the different errors of refraction, the hyperopia, and then they show how it looks when it's corrected, myopia, and they also show when that is corrected. This box also, it talks about assisting your sight impaired patients once again. And this one, that box we've already covered. So strabismus. Strabismus is a misalignment of eye movements, usually caused by muscle incoordination. So although most of the newborns are born with some degree of strabismus, its coordination improves as the infant grows and the eye muscles strengthen. However, the strabismus does not resolve in some cases and requires medical attention. So strabismus may take any of the following forms: estropic, which is a cross or a convergent; exotropic, which is a wall or divergent; hypotropic, which is a deviation downward; hypertropic, which is a deviation upward; concomitant, with both eyes moving together; non-concomitant, with the eyes moving independently. All of these treatments may require patching or covering and the unaffected eye to force the affected eye's muscles to strengthen. And then in some cases, surgery is required to correct the deviant muscle or muscles. So these are the forms of strabismus. The top one is the estrotropic, then you've got the exotropic, and then you've got hypotropic. So color deficits. Color deficit is the absence of a defect in color perception, better known as color blindness. So the reds, the greens, the blue perception deficit is deficit, or it is missing. There is no cure or any correction. This disorder is usually inherited on the X chromosome and affects more men than women. So this is an ophthalmoscope. It views the inner surfaces of the eye. So now your visual acuity testing. Visual acuity or clearness is commonly assessed in the medical office using the Snellen chart. These charts are hung 20 feet from the patient at eye level in an area with good lighting and few distractions. So they test the acuity on the Snellen chart, the E chart. They use the E chart if you cannot read English, and then they use the picture chart for children. So 20/20 vision is basically when you can see at 20 feet what the normal eye can see. That's how they diagnose the vision. So the patient should wear any corrective lenses for the test unless the physician requests that the examination be done without them. Examples of the charts: the Snellen charts that are used to assess for distant vision. The chart on the left and right are used for young children and illiterate adults. The chart in the middle, that is your basic Snellen chart. So for color deficit testing, patients with the deficit color perception are unable to see the design, the numbers or letters on plates 1 to 11, depending on their color deficit. This is an example of a color plate. Your color, your Ishihara method, it uses 14 different color plates with 4 colors. So tonometry and gonioscopy. Tonometry, it measures intraocular pressure, where your gonioscopy, it is an angle of anterior chamber between the iris and the cornea. So gonioscopy, also performed at your ophthalmologist or optometrist office, is the use of a special instrument, which is a gonioscope, to measure the angle of the anterior chamber between the iris and the cornea. So therapeutic procedures for the eye. Medical assistants frequently have the responsibility of instilling ophthalmic medications and teaching the patients about the procedure for home. Installations of eye medications to help treat infections or irritations, may be used to dilate the pupil for your retinal examinations or to apply an anesthetic for treatment or testing. And then eye irrigations may also be ordered by the physician. So some common disorders of the ear. Moving on to the ear. The ear is divided into three sections. You have the external ear, the middle ear, and the inner ear. Patients who have problems with the ear or hearing are often referred to an otolaryngologist. And when sound waves hit the tympanic membrane, vibrations, they pass through the structures in the middle and the inner ear. So this is a picture of the ear showing the outer, the middle, and the inner subdivisions. This photo is located on page 769 in your books. This box, it talks about assisting now your hearing impaired patients, and it gives you some very good tips on how to assist them, which is located on 769 in your books also. Ceruminosis. Ceruminosis or impacted earwax. This is a frequent reason for diminished hearing. Cerumen is usually a yellowish or a brownish wax-like secretion in the external ear canal, which we basically know as earwax. This will be a cause of diminished hearing, tinnitus, which tinnitus is an extraneous noise heard in one or both ears, is described as a whirring, a ringing, a whistling, or a roaring. It may be continuous or it could be intermittent. For the impacted earwax, you want to treat it with some warm ear drops or some hydrogen peroxide. The warm wax, it's softened by the eardrops or the hydrogen peroxide. So an otoscope is the instrument that is used for the visual examination of the ear canal and the tympanic membrane. So now we'll talk about conductive and perceptual hearing loss. Conductive and perceptual hearing loss are two categories of hearing impairment. Conductive, it is a diminished transmission of sounds to the cochlea, treatable with hearing aids. And then perceptual, it is a sensory neural transmission to the brain. This is not treatable. Both can have some effectiveness of mixed deafness. When patients have both, the condition is called mixed deafness. Presbycusis, it is the loss of hearing associated with aging. So some of the causes are, it could be hereditary, it could be from infection and trauma, autotoxic drugs, some neurological diseases, exposure to loud noises, and then presbycusis, and it is diagnosed with an audiometer. So your treatment is aimed at addressing the underlying cause of the hearing loss if possible. Meniere's disease. Meniere's disease is a degenerative condition of unknown cause. It affects the inner ear and upsets the body's ability to maintain equilibrium, in addition to causing loss of hearing. So the symptoms include vertigo, hearing loss, nausea. There is no cure. It destroys the inner ear. Destroying the inner ear helps to relieve the symptoms, but the patient does experience permanent deafness. Otitis externa. This is also known as swimmer's ear. It is an inflammation or an infection of the external ear. You treat it with irrigation, antibiotic drops, and warm compresses. So basically the ear is red and it's swollen, the ear canal. Otitis media. Pathogens that are responsible for pharyngitis, nasopharyngitis, and the common cold frequently travel through the warm, moist Eustachian tubes into the middle ear. So this is a picture of a bulging tympanic membrane of a patient with otitis media, which is basically just an ear infection. So the symptoms: severe pain, hearing loss, eventually the rupture of the tympanic membrane, and this will cause fussiness and ear tugging in children. Otitis media is common in children because they have shorter eustachian tubes. This could be exacerbated by nighttime bottle feeders. So this disorder is common in children and infants because of the relatively horizontal position of the eustachian tube between the nasopharynx and the middle ear. You treat it with antibiotics, analgesics for pain. Incision of the tympanic membrane may be necessary, which is a myringotomy, which is an incision into the tympanic membrane to relieve the pressure. So otosclerosis. Otosclerosis is a disorder of the ossicles of the inner ear, especially the stapes bone. This is basically, it is thought to be hereditary. It results from ossification or hardening of the bones, causing loss of hearing or low tones. The treatment for otosclerosis is hearing aids, or microsurgical implantation of a stapedioprosthesis to replace the sclerotic joint and allow the movement of the bones. This is just an example of a visual examination. So audiometry and tympanometry. An audiometer can be used to detect hearing loss. And then tympanometry, it uses air pressure on the eardrum to detect hearing loss. So the impedance audiometry evaluates the tympanic membrane and the ossicle mobility. And then your tympanometry works like the audiometer but uses air pressure rather than tones to produce the graph. And then the decibels are the units of the intensity of sound. So a tuning fork test. There are two tests that may be performed using the tuning fork that are the Rhine test and the Weber test. Although the physician most likely is the one who performs the tuning fork test, you should ensure that the tuning fork is available and assist is needed. Irrigations and installations. The ear irrigations are performed to relieve pain, to remove debris or foreign objects, or to apply medication solutions. And then your ear medications include the words for otic use only on the label. That's very important, that your patients know which route that they should be using for their medications. Allergic rhinitis. It is inflammation of the mucous membranes of the nasal passages, usually resulting from the exposure to an allergen. Symptomatic treatment with antihistamine medication is usually offered to relieve the symptoms. It is also known as hay fever, which is normally seasonal. It appears in response to seasonal plant pollens. If the symptoms are present year-round, it is a perennial allergic rhinitis and is usually a reaction to some household irritants. And then you want to treat this with antihistamines. The signs are obvious with paroxysmal sneezing, intense rhinorrhea, which is nasal drainage, and then congestion and the watery red eyes. Epistasis is commonly known as a nosebleed. Epistasis generally occurs from trauma to the nasal membranes, but it may be secondary to another disorder such as hypertension, malignancy, polyps, or the fragile capillaries associated with pregnancy. Diagnosis necessitates a history and an inspection of the nasal mucosa with a nasal speculum. If they are 10 minutes or more This is considered severe, and so they may have to insert a balloon catheter, some packing, or some cautery. So bleeding that continues more than 10 minutes after treatment begins is considered severe. So some physical examination of the nose with the nasal speculum. This is pictured here. So nasal polyps. Nasal polyps are small, pendulous tissues that obstruct breathing, often due to long-term allergies. Treat this with corticosteroids, possible surgery, and then you want to make sure you treat their allergies. Sinusitis is or inflammation of one or more of the sinus cavities, can be either acute or chronic. Acute is normally due to an upper respiratory infection. Chronic could come from hard nose blowing. Serious complications in the brain and the middle ear may occur if sinusitis is not treated properly with antihistamines or ephedrine. Nose drops to strengthen the mucosal tissue and relieve pressure. So you want to treat it with antihistamines, some epinephrine, antibiotics, or possible surgery. Pharyngitis and tonsillitis. You may be asked to obtain a throat specimen from these patients for transportation to an outside laboratory for a culture, or you may be required to perform a rapid stress test. Pharyngitis, it is a sore throat. There is inflammation of the throat and the tissues. Tonsillitis is inflammation of the tonsils. A throat infection can be diagnosed by culturing or a rapid stress test, treated with gargling, antibiotics, or a tonsillectomy. This is a picture of pharyngitis with swollen tonsils that's found on 773 in your book. Laryngitis, it is inflammation of the larynx. It can result from an infection, from irritation, or the overuse of the voice. If it is infectious, you want to treat it with antibiotics. If it's non-infectious, treat it with rest, basically not using your voice. So diagnostic studies of the nose and throat. Examination of the nose and throat entails visually inspecting the nose using a nasal speculum or viewing the throat using a pen light and a tongue depressor. So for visual inspection with the nose, you'll have the nasal speculum. With the throat, the doctor will use a pen light and a tongue depressor. Radiography and a culture to identify the infectious microorganisms. The lymph nodes in the neck are palpated, and then also other neck structures that are related to the upper airway. A throat culture in cases of suspected pharyngitis or tonsillitis can help determine what microorganisms are causing the problems. So for a throat culture, you want to use a sterile swab to avoid culturing the microorganisms, not the throat. Process the specimen in the office with a test kit, or it can be sent out to a different laboratory. And then if it is sent to a laboratory, place it in the culture medium. Make sure you label it. Label is always important. And then send it in a biohazard bag.